These are the friends and family that came to watch me do my speech. Alzheimer's disease is progressive. With this progression, a person's ability to communicate becomes confused and frustrating. Are you ready to understand what this means to not only be the individual affected by this disease, but to you in relating to this person? The world as you know it and your interactions history with loved ones will either change gradually or be placed on the fast track. What if the color blue was no longer the color blue? What if a piece of broccoli did not look like a piece of broccoli? What if a cup of tea was set right in front of you and didn't recognize it? What if the person you loved, your mother, looked you right in the eye and asked who you were and where you grew up? What if the person pointed out the window and described a bunch of men working in the dark with lights shining or a boat sailing on the side of a garage? The truth is, according to AllPsych, 96% of people affected by Alzheimer's are 65 and older, and the remaining 4% are younger. So how do you really communicate to that individual and show understanding and not create frustration? Alzheimer's disease causes difficulty in thinking, concentrating, and reasoning. Oftentimes repetitive questions are asked or events are even forgotten. Difficulty thinking of common words to describe objects or feelings is common. Writing down information or even signing a name becomes difficult. Many communication forms that used to be taken for granted diminish with this disease over time. Expressions take the form of words because words are hard to express. Reading words also become difficult because the words themselves are no longer understood. So have you ever wondered what losing your sense of the world as you know it today would be like? How would you communicate if you couldn't describe people, places, memories, thoughts, or feelings? Would you know you couldn't do this? The decline of brain cells and what this does to a patient with Alzheimer's continues to be researched. The disease affects each Alzheimer's person differently with stages. And according to alz.org, there are 3 different stages, starting with earliest Alzheimer's stage. During this stage, the learning and memory, thinking, and planning tends to be affected. During this stage, individuals should not be excluded from conversations, as this could include the person feeling different or being isolated. Give good response time and be patient. Look the individual in the eye and ask direct questions. And include laughter. The next stage would be the mild, moderate Alzheimer's stage. Speaking and understanding tend to be affected, and the sense of feeling and knowing who you are tend to be affected as well. During the moderate stage, communication becomes more difficult. Avoid criticizing or correcting the person and let them talk. Offer comfort and reassurance. Ask direct questions. Offer step-by-step process. And give visual cues to help understand the request. So, in Communication Matters, Corey Floyd once described communication as a process by which people use signs, symbols, and behaviors to exchange info. During the severe Alzheimer's stage, communication is affected greatly. Words and communication have declined even further during this stage. People may rely on facial expressions, gestures, or even sounds. Finding right words have now even become more hard, so the expressions and gestures are typically used. Communication changes with memory. Interactions with words may lead to individual not knowing how to describe something, so they tend to point. And some other statistics that I had found on TRCI, which houses the statistics of Alzheimer's, Iowa alone in 2014 had 1,300 deaths from this disease. From 2000 to 2014, there's an increase of 11.7 outcome for the rate of death. And other statistics include 45% of the patients need help getting out of bed compared to the 43 that of regular patients that need help. And 33% need help feeding compared to the 20% of regular patients. When diagnosing a patient, there's many ways of testing. Doctors typically ask about overall health and medical history. Many include memory-related problem solving, attention, and counting. Other things such as CTs, MRIs, or PETs are also done. Once diagnosis is determined, many resources are available for assistance. The gradual process of Alzheimer's is indeed a process that leads to new understandings for a patient and loved ones involved. To answer the question, how would you react if your own mother no longer knows who you are? As this is a difficult situation, you react and interact with new forms of communication. You would learn to communicate describing people, places, memories, thoughts, and feelings as well in ways Alzheimer's patients understand. They would communicate differently as well. Words often wouldn't be used. Gestures, facial expressions, and sounds take place of words. The disease is progressive. Each stage represents a different level of mental decline. To be effective, have empathy and compassion during these stages for the individual. The world, the individual, and loved ones understand often for decades has changed.